Greetings and welcome to another episode of Going All In, Get the Edge You Need to Succeed. I'm Dr. Erin McKinley, and today we have for you another awesome second spotlight session with Elizabeth Moore from the McNeese State University Masters and Dietetic Internship program based in Lake Charles, Louisiana. Check it out. All right, Elizabeth, welcome back to the podcast for an update. So for any new viewers out there, give us an introduction to you, your journey to RD, and how you landed in your position with McNeese State.
I am a registered dietitian. I graduated my undergraduate and my master's internship from McNeese. So blue, gold, that's me. And so when I graduated, I took the RD exam, became an RD, and I worked in the field. I worked clinical in the hospitals, and I did pretty much everything. And I was a preceptor during that time. But I did renal, I did surgery, rehab, and ICU was kind of where I ultimately wanted to be with nutrition support. I did that for 3 years and I really enjoyed it, but I wanted a next step. I went into management, hated that, spent a whole year there. Glad I got that experience, but then a position opened up here at McNeese to teach undergraduate. And when that opened up, it was just sort of like the right time, right place situation. Went to McNeese, started teaching undergraduate, and currently working almost done with my PhD. Don't want to jinx it, but I'm now the director of the internship portion of our program. And I'm going to go through just some major changes that we had in our program that I think are honestly for the better, and students are going to like that a lot better. So I'm just going to go ahead and get started. We're McNeese State University. We are a combined dietetic internship and master's program. We're located in Lake Charles, Louisiana. That is just 2 hours west of Baton Rouge. I had to think about my map. And we are a smaller town. It's kind of nice because a lot less traffic, a lot easier to get around. But it definitely is a lot smaller than Baton Rouge, but it still has a very young community, and our community is trying to get more things for the youth, a healthier wellness environment. So Lake Charles is starting to kind of go towards that. So I'm really enjoying to see that expand. But major changes for our program. First, I'm now the internship director, and so that's the biggest change. Our director before me had been in this position for 20 plus years, so she basically knew the ins and outs of everything. But so now this is my first time. However, I've been a student, I've been an intern, I've been a preceptor, and I taught undergraduate, so I feel like I have the tools to take this part of the program over. So some of the changes, we've had a lot of changes actually, besides the fact that we have a new director, which is me. Our master's program is different. We have our master's of science. It's still a master's of science, but now instead it used to be in health and human performance. Now we have it in the College of Agricultural Science with the concentration in nutrition science. And that's really beneficial because now the director, the people that are in our building have more oversight on the research that the students are doing. So they have a lot more hands-on one-on-one, a lot of less miscommunication about what their proposal and their research is going on. And so bringing it to our department has been, I think, going to be a very good thing to happen. The rotation layout. So I'm going to show this in my next slide to show the degree plan, but rotations used to, and when I say rotations, I just mean your clinical supervised practice, that when you go into your different rotations, the students would start their coursework in the fall and then start their rotations in the spring. That's not the case anymore. When you start in the fall, you start your first set of rotations, and we break it down. So your first rotations are clinical 1, and that's to basically give you the main layout of being in clinical 1. basically your basic nutrition stuff that you need to know in the hospitals. Clinical 2 is when we're starting to add more nutrition support, more renal, more complex patients, and really trying to build that this intern's capability of handling those patients. And it's nice now because when students used to start their rotations, they would start in the spring and everybody would start everywhere. They would have some in food service, some in outpatient, and some in clinical, and then they would just kind of switch throughout the whole time. There's no break. Now they're all going through clinical at the same time together. So when we meet and talk, we're all having kind of the same experiences together. We're talking through the difficulties, the issues that they're having when they do assessments, when they do follow-ups, when they do educations, anything in that clinical setting. And so you finish that, and then dietetic internship 1 is all of our outpatient stuff, all of our wellness, food service management, anything that is not in the hospital that doesn't that requires inpatient care. Our rotations used to be Monday through Thursday. Now they're Monday through Friday. And there's a reason why that is. Rotations are only during the semesters, which in a way is very much to the benefit of the student, the intern, because then one of the biggest things is that students said when they would go to rotations, once they started, they never had much of a break. And so doctor's appointments, going home to see family was a lot more difficult. During the semesters, that's when you do your rotations. When the semester ends, you have that break. So it's nice to know that you're going to go home for Thanksgiving, you're going to go home for Christmas, you're going to have that little bit of a break to catch your breath before that next semester starts, versus the old way. Once you start, you're in it till the very end. So I definitely think there's a picture of it, and you can see this is our new curriculum. We have clinical 1 right here. And in that first semester, we're jumping right into research methods and really trying to get your proposal going and talk about advanced nutrition and metabolism and advanced MNT. But you can see how it follows in that semester. Once that semester is over, you will have that break. Other changes, those are the major changes. Clinical rotation sites, this is where you're going to get all your clinical 1 and your clinical 2. These are the 3 major hospitals that we have. You go to St. Patrick's Hospital, Lake Area, West Calcan Memorial. I don't know how much y'all are familiar with Lake Charles or what's surrounding it. The furthest travel that you do go is to Jennings or to DeRidder. And so those are about 45 minutes, and that's about it. So nothing longer than that. Community site rotations, these are going to be where you're going to do dietetic internship 1, dietetic internship 2. So that's going to include the school board, that's going to include our endocrine system, our endocrine clinic, our ag extension services, dialysis. We are going to do a lot of renal and clinical 2, but they will still try to do the dialysis clinics as outpatient. And so those are the major changes. I think more than anything, breaking it down by semesters makes it so much easier for the students. It makes it to where even though they're working very hard during their clinical rotations, they know there's a little bit of a light at the end of the tunnel, a little bit of a break where they can kind of catch their breath, evaluate what they need to improve on, and then move forward. Those are the major changes that we have to our system. Applications still the same. Admission requirements are still the same. Those are the major changes that we have. Nothing really different from that. I think the new students really do like the schedule. My older students that are on their way out are a little bit jealous and wish that was their schedule, but it's whatever it is. But that's what I got. What questions you got for me?
All right. Thank you for that overview. We're going to jump into the new set of 5 questions that I asked the programs that are coming on this fall to give us an update about their program. And so my first question is, what is one major improvement to your program that was born out of the COVID-19 pandemic?
I love the normalcy of Zoom meetings and being able to step in with students on a moment's basis to touch base with them one face to face, and that being more normal as a meeting way is extremely important because it makes it easier for them with their schedules for us to all meet at the same time. Because if I'm always relying on meeting after rotations, in the afternoon, everybody getting there in their car, being there on time, weather, all these different aspects or variables that make it more difficult. Being able to say, hey, let's Zoom meet at 5:30. We're going to discuss this case study. We're going to discuss this assignment. I love how much more normal that is and how much easier that is for the students. For me, I love meeting in person above all, but I like being able to touch base and seeing faces, and that being, because I can talk to you on the phone, but I want to see like your facial expressions. I want to see if you're confused. I want to see, that. And so Zoom allows that. And so that's probably one of my favorite things. And also it allowed us to do a lot of, because the students weren't able to go into the renal dialysis clinics, we facilitated case studies with students from Louisiana Tech, from Fran U, from, I want to say there was one more, I want to say Nichols maybe, that they all were able to get on a Zoom meeting from different facilities and present their renal case studies. And I think that normally would never happen before Zoom, or we had to find those creative ways to meet those knowledge requirements, the competency requirements.
All right. So looking ahead, what does your ideal class of interns look like to you?
My ideal class is, I love a good attitude. I cannot stand pessimistic attitudes. I think because there's always going to be obstacles. So if you're just ready to tackle whatever comes your way, you're going to do so much better. Because when you do go into different facilities, you're there for 2 weeks or you're there for 1 week, and then you go to another facility and you're there for 9 weeks. You're constantly going through different scenarios. And so you have to be able to kind of roll with the punches and just understand that there's a process. So my best experiences is always with students who are good attitude, willing to get dirty and do whatever is expected, and just showing up on time and just being open to not everything is going to be perfect, and that they just maintaining that good attitude is such a big thing. And sometimes it's hard. Sometimes it's hard for me too. I see, it's wearing on them, but perseverance, good attitude go so far. They go so far versus being able to know everything, know how to do a TPN like that. I've had really smart interns when I was a preceptor, but not always not very proactive, not very going out of their way to get all the experiences they can. And then I have some that struggle, but they show up on time, they want to learn. And those are the students I want. I want the ones who want to learn and who are prepared to just take on whatever we give them.
All right. So what are you currently doing to improve the diversity of the incoming intern classes?
So I just took over this position this summer. We do have undergraduates, so we do have students who do apply to our program that we know. But one thing I'm trying to do is look for different ways to promote our program, just so I feel like when you bring in more people, when you bring in different ideas, different regions of the area, you bring in more information, you make your program stronger. So I think what I've really been trying to do, or at least working on, is things like this. Doing podcasts, finding webinars when they have undergraduate students from all across the US. Those are kind of the things I'm looking for right now, promoting our program so that we can kind of break outside of Louisiana. Because at one point we had students from Virginia, Alaska, Minnesota, all over the United States. And I like what they brought to it because they bring different perspectives, different backgrounds. And I feel like that makes everybody, I don't know, it just kind of gives you different perspectives, and it makes you kind of see things differently when you can kind of get a lot of different people into the mix. And so that's always something I like. And so that's kind of the way I've seen to do it right now, is just promoting our program and really trying to venture out the normal marketing methods and see who bites and who wants to probably come to Lake Charles, Louisiana for 18 months.
All right. So how are you implementing diversity, equity, and inclusion information into the program for improved patient-client care experiences for the interns? So what are you implementing into the curriculum?
Okay, that's a great question. Other than the biggest thing, I think, is trying to make the students more comfortable with when somebody's not just like them, whether it be differences in financial, whether it be differences in ethnicity, culture, how can they feel more comfortable in that situation to try to talk to patients, how to get that information. And if they are basically working through the things that they're uncomfortable with, or they're not sure about, or making them more comfortable with asking uncomfortable questions. Hold on, wait, we got to fix this. You're editing that out. Okay, hold on. How are implementing diversity and equity and inclusion information in your program improve client experience and blah, blah, blah. What we're trying to do is talk more about it is the biggest thing, because not talking about it is not helping. So I think talking about it and including it in our case studies, including it, one of the biggest things is they have to get so many case studies. A couple of those have to be from different background patients. They have to find a Spanish speaking one or somebody who doesn't speak English. They have to, because if you're not seeking that stuff out, sometimes they just get what's the easiest case study that they can get their hands on in that day. And so what we try to encourage is that you need to reach out and try to get different types of patients. And if there is a language barrier, be with the dietitian, go through that process with the transcribing. Like when I was in the hospitals, we had like a language line. So now with all the different things like Google translation, all that, I'm like, you need to say, hey, can I be a part of this process just to watch it and observe it? We're always trying to find better ways to offer nutritional services in a way that the client and the dietitian are just a better environment, a more open environment, more inclusive environment, and not to be so scared when somebody's not exactly like you is conversations we have. And that's sometimes difficult and sometimes they're open to it. Really specifically things I'm not sure right now, but the main thing is like telling them to get dirty into get in there, look for the patients that are not your typical from Louisiana, from here, look for our patients. I think we had a Russian patient one time that was a case study because he had a heart attack at the port. And so I was like, they were like, I don't know if I want to go deal with that. I was like, no, that's the experience. That's the learning part. You need to go be. So she went into the room when they were doing the Google translation with the patient and just watching that. I was like, that's experience. That's letting you know, like, there's ways to get around some of these obstacles. You know, there's not always a no pass zone. And so inclusion and all that is just keeping things open and being okay with, you're going to have patients that maybe you're not sure what to do with, but just being open that you're there to offer nutritional advice. And if you don't offer it, if you don't seize the moment, that person could definitely suffer. Their diabetes could be worse off because you didn't take it upon yourself. It's like, you always can't just put it on to the next person to deal with, you know, taking it on themselves.
Other than the skills that the interns acquire and practice through those required CRDNs, what other skills-based training are you including in the program?
We want to do interview practice. We're kind of learning how to do more professionalism practice. And that can be an email, that can be sitting down with somebody and saying, I'm uncomfortable, you know, how to be assertive and professional and, you know, and handle those situations. Because even though they may have like the nutritional background and stuff, if you can't handle dealing with people, you're not going to do well in the RD world, because RDs, all we do is deal with people. So how to handle when they are flustered or they're unsure of how to handle those situations or things we're seeing that they struggle with. And all of them are they're so different. And it's so weird how one can perfectly do really well at this one rotation and another student, for some reason, it just doesn't click. And sometimes there's personality differences in them learning how to work through those personality differences and still maintain function, still maintain what the objective is which is caring for the patient. You know, you're not going to always be able to get along with every single person you deal with, or even an intern or even a teacher, but you still have to show up, be professional, and execute what you're trying to do. And they're trying to get through their internship, they're trying to get through their master's. I think one of the biggest things is if they're uncomfortable, they don't want to go ask questions, or they don't want to say there's a problem. And I'm just sort of like, you have to, and I'm not saying you have to walk in there and divulge every single thing that you're bothered about, but you do have to sometimes be able to go into a situation and say, I need this. This is what I need. Is this not the problem? You know, it's just learning how for them to navigate the professional part of working in the real world. Because one of the biggest things I learned as an intern is that not all adults act like adults. And so I think that sometimes catches some of the students off guard. And, you know, and they're in that student environment and they're with their preceptors and having, you know, and if the preceptor starts talking about somebody else or being inappropriate, how to handle those situations. And I think some of those things do carry over even when they graduate. Life lessons are some things that we're trying to improve upon and how to handle those situations. And I think in a way, if they can handle those uncomfortable situations when it comes to equity, when it comes to inclusion, that helps as well. Realizing that you don't always have to go on the defense, you know, just being open to what people are saying and not taking everything personal so that you can make the right decision moving forward. And so is there a class that we call that? No, we just sort of approach that in different ways. Sitting down for an interview is a big one, because sometimes like they sit with me and I'll ask them the questions I normally would. And they're like, I didn't realize I should have answered that way. And that's helpful, because when they go to do interviews or go to do applications, putting their experiences and really trying to boast about themselves and sell themselves and how to do that in a respectful way and things to kind of set them apart so they can get hired. Because we want to help the student as a whole, not just academics, see you later, you got your degree. We want to really help them be successful RDs when they go past this, and learning how to be good mentors and good role models is a big one as well.
All right, well, that was all the questions that I had for this update episode. So to close us out, give us a really nice take-home message for potential applicants this year.
I think you just need to know how to sell yourself. Nobody wants to boast when they do their personal statement. You need to do that. You need to say, play to your strengths. You are your own advocate. Tell us what you are doing well. Don't be scared to be your own advocate, because I think that's something that's important, that you have to know yourself. You have to be confident in yourself. And that shows in that personal statement. And so that's probably one of the best things I can say. And just really being open to different experiences that you're going to have, and that it's not always going to be easy or fun, but at the end of it, you're going to learn so much more from the positive, the negatives, the ups and downs. But to get to that, you need to sell yourself. You need to sell yourself. You need to advocate for you and believe in yourself, because when you do that, I can feel that in the personal statements. I've seen the personal statements that are very, that I just don't really feel the person who's writing it. And so when you do that, take that moment to really think about it and to articulate like why you want that spot. And I guarantee you that the directors can read that, they can feel it. And so just taking time, don't just like hurry up and put something together. Put it together, think about it, let somebody else read it to make sure it makes sense. Because I do that. I write stuff and I think it makes sense, and then somebody else reads it, or I'm giving out a test and it's wrong. So definitely proofread. That's super important. But just one day at a time, and just making sure that you ask questions if you don't know something or you need help.
A big thanks to Elizabeth for joining us again on the podcast. And for those at home who would like some more information about the program at McNeese State, I would definitely check out episode 25 of this podcast, as well as check out the link to their program that I've provided for you in the description below this video. And as always, don't forget to like this video and subscribe so you never miss an episode with another awesome dietetic internship. And we'll see you next time. Bye.